Welcome to Cancer Chronicles, Journeys of Resilience, Tenacity, and Hope. I'm Scott Gurian. This series comes to you from the Rutgers Cancer Institute, New Jersey's only National Cancer Institute-designated comprehensive cancer center. Cancer is the second leading cause of death in the United States, but it's a topic many people tend to shy away from, so the Cancer Institute is trying to change that. Last fall, they organized a series of storytelling workshops, culminating in a public story slam event. On each episode of the show, we're featuring another one of the participants from that story slam, and today we hear from Sarah Scharf, who's the executive director of the Rutgers Cancer Institute's Cancer Health Equity Center of Excellence. She told her story before a live audience about the importance of genetic testing and having difficult conversations.
I have a large and complicated family, and every time we get together for a family function, I get anxious. And whether it's for a celebration, a wedding, a holiday, or a milestone, or even a funeral, I'm excited to see them, but I'm mainly anxious. And I think inside my head before a family function, what are they going to ask me? How are they going to judge me? Who's going to get under my skin this time? But I still go because I love them. And several years back, I was attending a family function that I was looking forward to because it was going to be a lot of extended family. And one of my cousins, Ani, who was in town from Argentina, was going to be there, and I really wanted to talk to her and meet her because I hadn't had a chance to ever meet her in person. I'm very close with her sister, but I haven't had a chance to actually meet her, and I was particularly excited about meeting her because she was here on a book tour, and I was going to be able to talk to her about her book. So during the family function, she tells me about her book and her exciting journey through the book, and I'm just really happy to hear about it. And then she segued into sharing the last couple of years have been a really big struggle, that she had a hard time losing her mother to cancer, and that she currently was battling cancer, along with her two daughters who were battling cancer. And that her healthcare provider had suggested that she get genetic testing, and found that in her family, in her mother's line, her maternal line, that there's Lynch syndrome. And I start thinking in my head, what is Lynch syndrome, knowing a little bit about it and Googling it, that it is a condition that increases your likelihood for certain cancers, and it's passed in your family line. And I start thinking, my mother had cancer in her 30s and passed away of cancer in her 40s. And could I have this? And could I pass this to my children? And could my sister have this and she passed this to her 8 children? And could my mother's brother and sister have this? Could they pass it to my aunt's 13 kids and her 20 plus grandkids that I stopped counting after 20? Or my uncle and his 2 kids and their kids? So I asked my cousin before she left if she would feel comfortable sharing her medical records with me. And she did. And I looked through them and saw that my grandmother's generation before her, there are 9 brothers and sisters, that 5 of them had passed away of colon cancer, and 1 of them of ovarian cancer. And that my grandmother's great-grandmother, who I was named after, Sarah, died of colon cancer. So I got chills, and I asked my mother's brother and sister, did you know that we have this much cancer in our family? And they looked at me, and they were dismissive. They were judgmental, they were defensive, and even hostile. And at this time, my grandmother, who was in her late 90s, was very ill and on her deathbed. And I had to engage in some very difficult conversations, very uncomfortable conversations with my family about getting her blood tested to see if she had passed on Lynch. So after much resistance, we got her blood tested, and it turns out that she was negative for Lynch. So this had me continuing asking questions about cancer in my family and talking to my healthcare provider about what that means to me and if there's something else that can happen. So my question and my thought is, talk to your family about their medical history. Even though it's a really uncomfortable conversation and could potentially be hostile, it's really important. And to share that information with your healthcare provider, and it could save your life or even the lives of your loved one. Thank you.
Sarah Scharf joins me now to talk some more about her story. So, Sarah, you told us about the occurrence of Lynch syndrome among many members of your family, and you said you didn't know anything about it at the beginning, so you did some research. Can you share some more of what you learned?
Yeah, sure. So I learned that it is much more common than we realize. In one of our Community Cancer Action Board meetings that we have at the Cancer Institute, one of our CAB members who started a foundation on Lynch syndrome spoke this past year and shared some facts and some details about it. And everybody in the room was shocked and was like, I've never heard about this. Why have I not heard about this? And I can't believe that it's more common than we think. I want to get tested right now. I want to talk to my family about getting tested. So one thing that had me learning more about this journey is that a lot of my family members have Lynch, and that the more we talk about it and the more we raise awareness, the more people can have discussions with their care providers and get testing to be able to know if their risk is increased, which can ultimately change their screening and preventative measures. For example, if you do get tested and you are positive, it's not a death sentence. It just means that you have to think differently about prevention and get screened earlier. So if you can get screened earlier, you may never have cancer, or it might be later. And one thing that I had learned in this journey, particularly with cancer that you can get from genetic mutations, is this idea of pre-survivors. And the pre-survivor is the idea of knowing that you're at high risk and that you're taking the preventative measures and you are getting screened earlier to prevent a cancer diagnosis. One of our CAB members from that organization shared that concept, and it really changed my idea into thinking that we can be doing something now, and you could be saving lives right now.
You spoke about how you tried to discuss all this with your family members, and they didn't seem to understand the importance of getting tested for this gene, and they were even dismissive of the dangers. Why do you think people are reluctant to have these sorts of conversations?
I think there's many reasons, and it's really hard to give an answer because each person probably has their own reason why. But if I had to go on my instinct, I think it's based on fear of the possible diagnosis of cancer and what that means potentially to their lifestyle and their length of life. But also there's a lot of perceptions around getting cancer, particularly certain types of cancers that perhaps people may feel were brought on by their behaviors, whether it's their eating, their physical activity, or whatever lifestyle behavioral factors that they had that may have led to it. So there's these stigmas around certain cancers, but also the fear of if you talk about it and you have it, then now you have to deal with cancer. And also in my own personal case with my mother, who had passed away of cancer in her late 40s, it was really hard and shocking for someone so young to die of cancer, and knowing years later that there could have been a genetic component that was really outside of her control. But if she learned about it earlier, she could have made changes to getting screened much earlier than the recommended guidelines because of this higher risk, and could have changed some of her lifestyle that would have either delayed or maybe never got diagnosed. But I'm hoping that by sharing this story, it could save lives of other family members just by talking about it and having those conversations with their care providers to get screened earlier and to include this in their care that they get.
Before we end this conversation, do you have any final thoughts you want to share?
I'm just really grateful to be a part of this opportunity, being able to share my story and to inspire others to be courageous and share their stories so that people can feel comfortable in sharing all the different ways that cancer impacts us. It's not just living through cancer and surviving it, but it's the perspectives of caregivers, physicians, nurses, social workers, everyone who's involved in the cancer journey, and also those who are touched by people who have cancers. It's everyone around us that is involved in the process, and we all have stories to share about how that impacts us and what we could do by talking more and increasing more awareness and education and getting screened and moving that line towards the opposite end where there's less incidence, less mortality.
Sarah Scharf is the Executive Director of the Rutgers Cancer Institute's Cancer Health Equity Center of Excellence, as well as the Deputy Director of the Screen NJ program, which works to increase awareness about the importance of cancer screenings. Cancer Chronicles is a project of the Rutgers Cancer Institute through a cross-department collaboration between the Cancer Health Equity Center of Excellence, the Office of Diversity, Equity, and Inclusion, and Cancer Research, Education, and Training. To learn more about the Cancer Institute's work, visit them on the web at cinj.org. This podcast series was produced by me, Scott Gurian, and the executive producers were Dan Swern and John Keller of Collab Arts, which engages artists, social advocates, and communities to create transformative new work. Our theme music was composed by Dave Seaman.